My name is Emily Bailey, and I'm going to be talking today about opioids and their use in spinal cord injury. Individuals with spinal cord injury are a very important population to discuss when it comes to opioid use and potential misuse. 4 out of 5 people living with spinal cord injuries deal with ongoing severe to excruciating neuropathic pain as a result of their injuries, as well as musculoskeletal pain from things like shoulder overuse, positioning, etc. This neuropathic pain is commonly felt in the regions where they have diminished or absent sensation, and it's often described as a constant burning, stabbing, or tingling pain. It's incredibly complex, but it drastically impacts the quality of life for these patients and can sometimes be debilitating. The prevalence of pain is incredibly high in this population, and opioids are commonly used and misused by this population. Because of the high prevalence of pain, this population is more likely to become long-term users and utilize really high doses because they have consistently high levels of pain. But at the end of the day, it's the patient's choice to either start opioids or taper off of them, but it's our job to ensure that they have all the information possible to make an informed decision that's truly best for them. And it's important that we notice some of the potential side effects that they can experience as well with these medications. So as we know, opioids can be very highly addictive drugs, and they come with a really wide variety of pretty severe side effects. But for individuals with spinal cord injuries, these side effects can actually be even more severe and fatal. So as we know, opioids have the potential of causing respiratory depression because of the way they cross the blood-brain barrier. For individuals with spinal cord injuries, they already have weakened respiratory systems, especially if they have cervical and upper thoracic injuries where their diaphragm and breathing muscles are affected. Also, over 50% of individuals with complete quadriplegia or tetraplegia experience sleep-distorted breathing. This is kind of like your standard sleep apnea, difficulty breathing at night and when you're sleeping. And 70 to 85% of people taking opioids experience sleep-distorted breathing. So you can imagine then that by having a spinal cord injury at that level and already having those issues, by taking opioids, you're further increasing the severity of that effect. And sleep-disordered breathing can lead to sleep disturbances, oxygen desaturations, and this can make the patient even more likely to experience hypertension, which comes with its own slew of medical complications, cognitive impairments, and can even be fatal. Some studies have shown that opioids may increase the risk of depression, with one study claiming to observe an 8 times increased risk of depression in spinal cord injury patients 1 year post-SCI after being treated with high doses of opioids within the acute phase of their injury. Depression is more common in the SCI population and affects 1 in 5 people. The use and potential misuse of drugs such as opioids that can worsen or increase the risk of depression should definitely be cautiously monitored. As far as gut motility goes, patients with SCI already experience decreased GI mobility, with up to 80% of individuals diagnosed with neurogenic bowel dysfunction. Bowel management is a huge key concern for this population. Bowel programs and uncontrolled bowels frequently interfere with their independence, cause embarrassment and social isolation, and may even have an effect on their personal relationships. Opioid use further increases the risk of these issues, with added risk of poor bowel emptying, bloating, constipation, and secondary chronic abdominal pain that really should be monitored with these patients. Additionally, studies have shown that there to be an increased risk of lower extremity fracture in SCI patients on opioids. The data has found that all SCI patients, regardless of their age, are at an increased risk, especially within the first 6 months of use when the doses are higher. So as far as why we should care as physical therapists, we play a huge role in the care and treatment of this population, especially within that first 6 months where that risk of fracture is really high in the lower extremity because of the high opioid doses during that time, but also beyond that. Inpatient treatment for SCI can last anywhere from 8 to 24 weeks, and follow-up outpatient rehab can last from months to years post-injury. So we really need to be aware of those increased risks, especially for fracture in those early months, mitigating fall risk and injury, but also watching out for all of the other negative side effects that opioids can have on this population and what we need to monitor for and educate our patients on. So we need to be able to be on the lookout for the signs and symptoms of misuse, respiratory effects, sleep deprivation, depression, bowel issues, and we need to be able to educate our patients on navigating these symptoms if they do arise. I put our mission statement on here as physical therapists to transform society by optimizing movement to improve the human experience, because part of the human experience is looking at our patients holistically and recognizing how all factors of their life and well-being affect their prognosis, their willingness to participate in therapy, and the effectiveness of our therapy sessions. And if our patient is taking an opioid and still has uncontrolled pain and is still experiencing side effects that are drastically impeding on their quality of life, such as the side effects that these individuals face, it's up to us to advocate for them and open up these lines of discussion between the patient and their rehabilitation physician. So I put together an informational pamphlet as a resource. You can go to that link to print it out or download it. That you can share with your SCI patients or for your own educational benefit, which outlines the signs and symptoms of misuse and signs of the side effects associated with opioid use in SCI. It also outlines information about how to approach a conversation about starting an opioid, as well as how to discuss weaning off of them. Not included in the pamphlet, it's important to note that there are very few, if any, randomized controlled studies that support the idea that opioids are effective for spinal cord injury in the short or long term. There are a lot of studies that are showing that those who taper off actually report improvements in overall function without a worsening of pain, and some even reported decreased levels of pain, as well as an overall improvement of their quality of life. So these are really just important discussions to have with our patients and to kind of facilitate between them and their physicians. And then these are my citations for this project. Thank you for listening.